Hello everyone. In this short video, let us discuss what is gout, what are the clinical features of gout, what are the causes of gout, and what is the treatment of gout. So, what is gout? Gout is a condition where there is hyperuricemia leading to urate precipitation in joints, leading to arthritis. What is hyperuricemia? It is increased level of uric acid in the blood. The normal uric acid level in the blood is around 6 to 7 milligrams per deciliter in males and 5 to 6 milligrams per deciliter in females. If the uric acid level goes beyond this, then it may precipitate in the joints leading to arthritis. So, what is the pathogenesis of gout? So, in all the cases of gout, there will be hyperuricemia, that is increased uric acid level in the blood, and whenever there is increased uric acid level, there may be supersaturation of extracellular fluid with a monosodium urate and crystallization. What is this supersaturation of ECF? Usually the uric acid is sparingly soluble in the plasma. When the uric acid level increases beyond certain level, then the extra uric acid level, this combines with sodium to become a monosodium urate salt, and this monosodium urate crystallizes. That means they precipitate and make a crystals. When these crystals gets deposited in the synovial joints, especially in the synovium and the synovial fluid of the joints, which leads to the inflammation of the joints, which is called as gouty arthritis. As you all know, arthritis is any inflammation of the joint, and if the inflammation is because of gout, we call it as gouty arthritis. The same monosodium urate crystals can accumulate in various soft organs like skin, skeletal muscle, etc., which are called as tophi. Sometimes this increased monosodium urate crystallization can also lead to urolithiasis with the uric acid stones. Urolithiasis is nothing but it is the stones in the renal tract, and these stones are made up of uric acid. So this is the basic defect and the pathogenesis in the gout. The most common affected site for this gouty arthritis is first MTP joint, first metatarsophalangeal joint, which is the great toe. As you can see in this picture, so this is the first MTP, where you can see there is inflammation of the first metatarsophalangeal joint. Here you can see there is deposition of crystals. These monosodium urate crystals appear needle-like under the microscope. If the same crystallization and deposition happens in the skin, subcutaneous tissue and the muscles, they are called as tophi. So why this happens? What are the causes of gout? The causes of gout may be classified as primary causes and secondary causes. Primary causes are invariably it is because of genetic defects or because of metabolic disorders, or if the cause is not known, then you classify it as primary causes. Secondary causes are those which are secondary to other clinical conditions. So these are also called as acquired causes. Now let us see what are the primary causes of gout. If the gout is manifested because of primary causes, such gout is called as primary gout. There are some 3-4 very important reasons all of us have to remember. The first primary cause for the gout is hyperactivity of PRPP synthetase, phosphoribosyl pyrophosphate synthetase. PRPP is an important compound which is a precursor for the synthesis of purine nucleotides. So when there is increased activity of PRPP synthetase, there is increased level of cellular PRPP, and because of overproduction of PRPP, all those will be converted to purines. So there is overproduction of purines. When the purines are formed extra, they have to be degraded, and when the purine degradation happens, ultimately uric acid is produced. That is why uric acid level in the blood increases. One more primary reason for gout is superactivity of PRPP glutamyl aminotransferase. So because of increased cellular PRPP and overproduction of purines, the more degradation of purines happens, leading to formation of uric acid and again leading to gout. HGPRT deficiency is another important primary cause. Hypoxanthine guanine phosphoribosyl transferase is HGPRT full form. Hypoxanthine guanine phosphoribosyl transferase is an enzyme which is required for salvage pathway of purine synthesis. So please remember, purine can be synthesized in two ways. So first one is de novo synthesis, where completely new ring structure is formed. One more is salvage pathway, where the degraded purine bases can be reutilized to produce the purine nucleotides. So HGPRT is an enzyme which is required for salvage pathway, that is recycling of the purine bases. In case of HGPRTase deficiency, the purine bases cannot be salvaged, cannot be reutilized, so they are broken down and converted to uric acid, which rises in the blood, leading to gout. Glucose 6 phosphatase deficiency. So this is an enzyme required for the last step of gluconeogenesis as well as glycogenolysis. And the glucose 6 phosphatase deficiency is known as von Gierk's disease. In this case also, there is increased glucose 6 phosphate which activates the HMP shunt pathway. And the products of HMP shunt pathway are two. One is ribose 5 phosphate and the NADPH. And ribose 5 phosphate, if it is increased, this will lead to increased production of PRPP, which is a precursor for purines. So there is enormous amounts of purines are produced, and once they are degraded, lot of uric acid is produced, leading to hyperuricemia. So these are the four important enzyme defects which can lead to primary gout. Even the abnormal variant of glutathione reductase is also known to be associated with gout. Now coming to the secondary gout. What are the secondary causes of gout? So these are the clinical conditions leading to the increased synthesis or decreased excretion of uric acid. For example, in case of malignancies, hyperuricemia is seen. So malignancy is nothing but it is a cancer, like in lymphoma, leukemia, and when you treat these leukemic patients, so they give many chemotoxic drugs, cytotoxic drugs. These drugs will kill the cells. When the cancerous cells are broken down, so a lot of purine nucleotides are produced and they have to be degraded, producing increased amount of uric acid. So increased cell turnover is the reason in case of malignancy, which will lead to hyperuricemia and gout. And in one of my video I have already shared, the excessive alcohol consumption may also precipitate the gout. So please remember, excessive alcohol consumption cannot be the only reason for gout. So because of some other primary reasons, if the person has hyperuricemia, such person, if he takes excessive alcohol, that will lead to acute precipitation of gouty attacks. So why excessive alcohol consumption leads to gout, that I have discussed in another video. All of you can check. The link will be shared in the comment box. High purine diet is also another reason which may lead to gout. So increased purine diet can be seen in case of non-vegetarians mainly, which will lead to the degradation of these purines, leading to hyperuricemia. Kidney diseases, yes, the uric acid has to be excreted through the kidney, and in case of abnormalities of kidney function, more and more uric acid stays in the blood, leading to hyperuricemia and further leading to gout. Preeclampsia. So, this is a condition in pregnancy where the mother experiences increased blood pressure and there will be swelling of the limbs. So, even in this case, the hyperuricemia is observed. So, lead poisoning is also another reason where the secondary gout can be seen. So, how do you identify the gout in a patient? So, usually the symptoms, like which is affecting the first metatarsophalangeal joint and it is aggravated by the alcohol consumption, all these point towards the diagnosis of gout. But the confirmation of gout can be done by the identification of urate crystals in the synovial fluid. The synovial fluid can be aspirated and visualized under the microscope, which will show the needle shaped structures of sodium urate crystals. So, what is the treatment for this? Allopurinol is the treatment of gout. This is the inhibitor of xanthine oxidase, which is the last enzyme in the pathway of degradation of purines. So, how allopurinol can be used to reduce the uric acid level, I have discussed in another video. The link will be shared in the description box. So, for the details, you can just refer to that video. Allopurinol inhibits the xanthine oxidase with a competitive inhibition, also called as suicidal inhibition. Along with this, uricosuric drugs like probenecid can be tried, which will stimulate the kidney to excrete more uric acid so that the blood uric acid level comes down. Colchicine, again, it's a anti-inflammatory agent which can reduce the pain, swelling, and other inflammatory reactions in the synovial joints. Thank you.